Welcome everyone to the Transportation Equity Task Force Lunch and Learn for today. Just as housekeeping, today is a little bit different because as you can see, everyone is able to speak and you're not muted. That's something that we haven't done in the past, but that's to help encourage interaction. So please keep yourself on mute until you need to speak, or we're actively working with you on a question that you have, and wait to be recognized. That would be very helpful. I'm Lisa Stedman. I'm a member of the Transportation Equity Task Force. The meeting's going to be recorded, and this recording will be posted online. So we take your participation in the Q&A as part of your consent to appear in the recording. If you should actively ask a question, your presence may be shown in that video. It's also going to be posted on YouTube. If you need to ask a question, you can use the raise your hand function to be recognized. Your name and your organization and role, if that's applicable, so that we can help build community over time. And also, in lieu of AI note takers, we're going to make this recording and AI summary available on the Able New Hampshire website. So there won't be as many AI note takers in this meeting as there have been in the past. Advocates Building Lasting Equality in New Hampshire, or Able New Hampshire, as we familiarly call it, advocates for civil and human rights of children and adults with disabilities. We promote full participation by improving systems, connecting families, inspiring communities, and influencing public policy. It has lots of very important task forces and initiatives. It's always doing good work around the state in many realms, such as Medicaid and also supportive education. In 2024, transportation equity was identified as one of our primary topics. And so we formed the Transportation Equity Task Force. And the task force has decided to run this Lunch and Learn series as part of its offering, because we want people with disabilities to become aware of the many transportation options and resources that are available, and to help them become comfortable using the tools to get where they need to go. This Lunch and Learn series has been going on for some time, and in the near future, we're going to have Lunch and Learn on shared mobility in June. July will be EDA complementary service. Sometimes we know that as paratransit or the friendly bus. And in August, we're going to talk about the community transportation needs assessment. As I mentioned, we've done lots of lunch and learns, and there is an archive available of all of the topics that we've covered in the past on the Able New Hampshire website. Please feel free to look there, and you're going to find the one-pagers and the recordings from our previous lunch and learns. Today, we're here to talk about non-medical transportation as a service option on Medicaid waivers. Lindsay McGee is going to be our primary speaker, and she has brought the BDS liaisons with her as well. At this time, I'm going to turn it over to Lindsay and let her take it away.
Thanks, Lisa. I am going to share my screen, I hope. Okay, can you see my presentation?
Technically.
Perfect. All right, so I'm Lindsay McGee.
Yes, I can see it perfect.
Thank you, guys. Lindsay McGee, I'm the waiver administrator with the Bureau of Developmental Services. And I do have a couple of our liaisons here, as well as our administrator, Melissa Acapenti, who oversees our team of liaisons. Stacy, Miriam, and Kristen Cather are here. Brianna Belfontaine is off today, but that is our group of liaisons. So I'm going to get started. So this service is applicable to our 3 1915C waivers that BDS oversees. So our developmental disabilities waiver, acquired brain disorder waiver, and the in-home supports waiver. So what is non-medical transportation? It is a service that's designed specifically to improve an individual and their caregiver's ability to access the community and community activities in response to needs that are identified in their service agreement. This can be things like transportation from one place to another, travel, training, different types of transportation, so public and community, taxi services, prepaid transportation cards, mileage reimbursement, rideshare services like Uber and Lyft, prepaid vouchers and cards, and parking tolls and fees. Some of you may know that our waivers, our three, are going through the renewal process this year, which is pretty exciting. The in-home supports waiver has already been approved by CMS. That happened on January 1st. So we have included language in that waiver, and also will be included in our DD and ABD renewals, that explicitly calls out rideshare services like Uber and Lyft, that they can be accessed and that those entities do meet the qualifications to provide this service. There was some kind of confusion, so we made sure that that's very clear. So now a little scenario. What could this service look like in the real world? This is a fictional scenario, so not based on anyone specific, but just to kind of give you guys an idea. So a little bit of background. Emily is a 22-year-old woman with a developmental disability who lives in an apartment. She enjoys participating in various community activities like visiting the library and volunteering at the animal shelter. Emily does not currently have a driver's license, so she is without transportation during the day. So how would Emily access and use non-medical transportation? So she learns about the service and works with her service coordinator to add it to her service agreement. Emily's service agreement outlines the transportation schedule, her preferred routes, and any necessary support during transit. Emily utilizes Uber vouchers to get to her community activities. So what's the outcome of this service for Emily? After accessing non-medical transportation, Emily gains a sense of independence as she now has transportation to attend her favorite activities. This boosts her confidence and social skills, and reliable transportation allows Emily to participate in more community activities, helps to lead a more fulfilling and active lifestyle. She gets to enjoy visiting the library and volunteering, all of which contribute to her overall well-being. So the waivers do outline specific service limits and requirements for what needs to be included in the service agreement. There are service limits outlined in the waivers. These are what we call soft limits, though, which means that they can be exceeded with prior approval from BDS. So not anything set in stone. If you need more, you're able to request more. So there is a $5,000 per year limit on traditional transportation, and then a $10,000 per year limit on specialized transportation. So if someone needs a wheelchair van or things like that, that could be more costly, there is a higher cap for that. So, but again, soft limit that can be exceeded with prior approval. I wanted to share also where you can find this presentation. We have a relatively newer page of our website called Individual and Family Resources, and we have tried to add information there that's specific to individuals and families, what our waivers look like, what the services look like. So we've created some, it's been called TikTok style presentations where you can either just look at the slideshow or you can listen to me go through this presentation in a webinar style video. And we have them for all of our services. I did mention that our waivers are up for renewal, and these will be updated with any updates that come from that. I also wanted to share our regional liaison list. So this is our current Bureau liaison list. We are down, unfortunately, 2 liaisons right now. So, and we're in a hiring freeze. So Melissa Acapenti, our administrator, is taking over some regions to help support. But this is the list of liaisons if there's a question, if, individual is coming up to some barriers potentially with the ability to access non-medical transportation, they're available to help kind of workshop some of those things. So I am going to stop sharing and turn it back to Lisa for any questions.
So now we're going to open it up for some questions because we want to have this sort of workshop style. We know that several of you have tried to set up this service option for clients, or you are a person who has tried to access this waiver service option, and you have a question about something that turned out to be a roadblock or a speed bump for you. So please raise your hand if you want to ask a question. We'll call upon you just to keep it orderly. Who would like to go first?
I just, Lisa, want to, there was a comment in the chat that for a question of, is this included in the CFI waiver? Non-medical transportation is included in the CFI waiver. That's just overseen by our Bureau of Aging and Adult Services, so not my bureau. My presentation is specific to the 3 waivers that BDS oversees.
I have a question. I'm looking for the thing.
We hear you, Kathy. What's your question?
My question, sorry, my question is about why it costs more for wheelchair transportation. I didn't quite hear. Did you get that?
Why does it cost more?
Yeah. Why does it cost more?
I don't know the specific reason for why it costs more for that transportation, but we did want to make sure that in the event that it does cost more, that limit is higher, so that individuals do have more funding to access transportation that might be more costly.
Well, I mean, somehow I'm not sure that sounds fair, because I mean, it's not anyone's fault that they're in a wheelchair.
Exactly. That's why that limit is higher, so that you can access more money.
Oh, okay. I guess I didn't understand that when you said that.
No problem.
Alonda?
Yes, I was just curious. It's kind of a specific question. I have a client that's looking to go from Claremont to the Social Security office in Concord. What would be the best source to get there for that? I felt like in the beginning it was only like medical appointments, but now it sounds like it's opened up to kind of a lot of different things.
Yeah, so this is specific to non-medical transportation. So the waivers can cover visits to non-medical visits. The MCOs and the state plan would cover anything medical related. So if the individual is on a waiver and wants to use this service, they could add that to do transportation trips like that.
Okay.
So to be clear, not everyone on Medicaid state plan has access to a waiver, because waiver is reserved for people with the most significant disabilities that would have them otherwise require an institutional level of care. So a lot of low-income people who are on Medicaid would not have access to this because unfortunately they're not on one of the waivers.
I see.
Andrew.
So, what about people who are on Mead out of curiosity? Would that also not apply to them?
Not unless they were on a waiver.
I guess, sorry, I should ask that a little bit better. Can someone who's on Mead also get a waiver, or are they also disqualified from getting one?
I have a waiver, and I'm on Mead. But see, what is it? It's not developmental services, it's the other one.
It's CFI, Choices for Independent.
CFI.
And
okay.
You can be on Mead and a waiver.
Yeah. a waiver basically just keeps you out of a nursing home.
Does anyone else have a question? I've got one. Am I allowed to go ahead and book a ride and then seek reimbursement for the ride after I've already traveled?
So this could depend on the agency that you're working with and what their policies and procedures are for booking rides and what that looks like and how it's outlined in the service agreement, but potentially that could be allowable.
How would one get started if they wanted to regularly have a friend or a family member helping them with their transportation?
So first step would be connecting with the service coordinator or your individual service coordinator to work with your area agency or your who would be your FMS entity to get that set up.
Can you define FMS entity?
Yes, fiscal management services. So our area agencies provide fiscal management services and they help with our pass-through billing, which is it gets kind of confusing, but non-medical transportation is a pass-through service that the area agencies help with billing.
Kelly.
I have a question. Why is the limit only $5,000? Is that gonna go up? And how long is the waiver that you just said it was just approved in January? Because I imagine the price of gas is going up now. I haven't noticed, because I do use Lyft, I haven't noticed that they're charging me a surcharge because of gas going up. But I know that $5,000 doesn't get me very far because I go to school twice a week. And my school is 1.2 miles from my apartment, so it's too far for me to walk. And it's too far for me to ride a bike or anything, and there's no bike rack at the school. So I was wondering, and then I go to yoga at least once a week because I have a monthly class pass. So I have to go at least once a week to make it worthwhile to pay the yoga studio a certain amount per month. So is it going to go up, do you think, or is it going to stay the same, that 5,000? And I understand that it's 10,000 if I needed a wheelchair van or something, because that's more expensive to provide. But at this point, I don't really need a wheelchair van because I'm going to go through physical therapy. So hopefully I won't need any surgery on my feet, which have problems at the moment. Thank you.
Thanks, Kelly. So the waiver that I mentioned that was approved on January 1st was the in-home supports waiver. And then our developmental disabilities waiver will hopefully be approved on September 1st. And then ABD waiver would be November 1st. The limit has not been proposed to be increased, but it is a soft limit. So that does mean that there's the ability, if you need more than that $5,000, to ask for additional funding. It really just allows us to have conversations of, is this the right service? And it's a way for us to sort of try to predict some of our funding needs too. So if we know that this is our limit, and it helps us a little bit, but there is the ability to exceed that cap.
I am going to call on Kristen, and in the meantime, I'm also going to be putting the current one-pager up onto screen with a QR code to access it so that you can get there easily. That'll be just hanging out on screen while Kristen asks her question.
Thank you. This question isn't necessarily for Lindsay. I think it's the whole group. I'm wondering if any organizations, FMS entities, have arrangements already with family members, neighbors, those kind of individualized arrangements for non-medical transportation, and how those arrangements, is it a contract or are they hired, how that works? Sounds like a great opportunity. I'm just not sure how to operationalize it.
I have this retired guy that I went to school with in like the 7th grade and in high school, and he drives me around sometimes. I have my own van. I just don't always have a driver.
Right. So it would be nice if you were on a waiver and you were able to get friends and family reimbursement for that person who helps you all of the time, right?
Yeah, it would.
So Lindsay, there must be agencies in the state that are successfully implementing this. Could you say where a peer could go to a peer to ask for guidance on what's worked for them?
I think that's something, and Kristen, that we can kind of workshop with our area agencies and our FMS entities to see, who's doing this well, who, has some tips, and I think we could work through it that way.
And the Bureau liaisons can help you to make connections as well. I would imagine they're seeing this getting implemented throughout the state, right?
Yes.
What about a voucher? If I wanted to get a voucher for a bus, where would I start?
Same thing. Service coordinator is always the first step. And then the service coordinator would work with the area agency to get that approved. A voucher is an approved way to get non-medical transportation. And Lisa, I did see a couple things in the chat too. So Janet, the map of regions, which I was desperately trying to find, is on the one pager that Lisa is sharing. So it is there. And Michelle had a question about, could this be used for a program that VR is offering? So voc rehab with someone in the in-home supports waiver. I do, Michelle, believe that that would be allowable. I think we would just want to look at it on an individualized basis with the liaison, but we can definitely take a look at that. And then Gateways asked a question, are drivers background checked with Uber or Lyft? That's a really good question. And it's actually why we added language in our waivers during this renewal process that entity transportation agencies like Uber and Lyft meet our provider qualifications, because we've done some really extensive work with Uber, and Lyft is very similar with their requirements. They actually go above and beyond background checks than what we require in our waivers. They do extensive checks. They also, Uber has a system where if one of their drivers is charged with a crime, it alerts them. I don't know how it all works, but it's pretty cool. So they are background checked as part of their process.
Janet, did you have another question?
Actually, it's a follow-up to the same question. Thanks, Lindsay, for seeing my item in the chat. So and thanks, Lisa, for posting the one pager at the right time when my hand was up about the map. But is the map, the original map, included at your online directory?
Yeah.
Okay, thank you.
The liaisons just might not be accurate because we've had to kind of switch them around a couple times. But
okay,
yes,
it's the image of the map I was interested in with the towns depicted.
Yes.
It's a little harder to read. Thank you very much.
Any other questions? While we're thinking, I'm going to go through a couple more slides and then we'll come back to questions. I want to give everyone an opportunity to fill out the closing survey. You can scan this QR code, and Creighton's also going to post the link. It's very helpful for us to get feedback on the presentations that we do, because there's also an opportunity there for you to ask additional questions of the presenters that will go directly to them so that you can start an interactive relationship with them, and we'll make sure we set that up. Also, it's helpful for us to know if there are other topics that you want to hear about in the future. And I'll come back to this closing survey QR code in just a minute. On June 19th, we're going to be talking about shared mobility, and shared mobility is all kinds of things like carpooling and ride sharing. Initiatives are forming all over the state of New Hampshire, and some of those are very innovative. This presentation was brought by ABLE New Hampshire. ABLE is a membership-based organization. We really rely on our members to help support us. And other than that, we're purely grant funded. We don't receive any kind of state or federal funding. So memberships are very important to us, and we encourage you to become a member. We have staff support here. Creighton who always is helping us with the waiting room and with the behind the scenes work. And we really appreciate that Able provides that for us.
Hi, my name is Anne Marie Cullen, and is this for just adults?
If a child with autism is on a waivered service, then they can have the non-medical transportation service option added to their waiver, and they too can participate in getting their non-medical transportation paid through the waiver.
And how would you go about finding that out? What's a waiver? Was a service provider? They don't have any of that. They have the school.
So it sounds like you'd be starting fresh with your area agency to try to establish a relationship with them and check for eligibility. And if you fill out our survey and you indicate that that's what you want to do, I'll make sure you get connected to all the right people.
All right, thank you.
Yeah, thanks for asking. I'm sure
Thanks.
someone else had that question too.
Okay, thanks.
And I see Peggy's question in the chat too about transportation to and from a job in the summer. And yes, Peggy, that is typically a reason why people access non-medical transportation. They may not need any support at employment, but they need a way to get to and from there. So that is something that an individual could access non-medical transportation for.
Are there any other questions? Okay, with that, I'm just going to wrap up for this portion of the Lunch and Learn. And if you want to hang out and have some more informal conversation with folks, you're more than welcome to do that if other questions come up. But thank you again for joining the Lunch and Learn for Able New Hampshire. We really appreciate everyone who attends these, and we hope to see you again.